I'm Karen Engle, and I teach at the University of Texas School of Law. And on behalf of the Bernard and Audrey Rapoport Center for Human Rights and Justice and the Sissy Farenthold Fund for Peace and Social Justice, I'm delighted to welcome you to this discussion of Professor Wendy Bach's new book, Prosecuting Poverty, Criminalizing Care. We have Wendy joining us from Knoxville, Tennessee, and Professor Aziza Ahmed from Boston University. And I'm actually joining from Melbourne, Australia, where it's already Wednesday morning, and I can say Tuesday was a great day, especially Tuesday afternoon. Wendy's book is so timely that I didn't want to wait until the spring semester in the US to talk about it. So this gave us an excuse to have this book launch on Zoom, where people could join us from a variety of places. I want to thank Caroline Hahn, who is the Rapoport Center Program Coordinator, for all of her logistical support on this event for us today, and she'll continue to help us out as we move along. So Wendy's book was just published in September, and though she's spoken about it before, this is the first talk since the book actually came out. So it's a launch of sorts. And Cambridge University Press has made a 25% discount available for the event. And Caroline will put a link in the chat for you to get the discount. It's also online in the information about the event. And if you click on the image of the book in the link, you can also read more about the book, but you might want to wait until after you've heard about it today. So note that we're using the chat to put some links as we go along, and you'll be able to save them at the end. Since we'll use the chat for that purpose, we ask that you post any questions in the Q&A. And if you are watching on YouTube, you can post your questions there, and one of our team members will communicate them to the panelists. So this event today is one of a series of events on reproductive justice hosted by the Rapoport Center's Sissy Farenthold Fund. The first two immediately followed the Supreme Court's decision in Dobbs. And then just before Thanksgiving, we co-sponsored a talk by NYU professor Melissa Murray on the racialized logics that have been used to undermine reproductive rights. And I'm delighted to announce or let you know that on February 15th, University of Pennsylvania professor Dorothy Roberts, one of the leaders of the reproductive justice movement, will deliver the Sissy Farenthold Endowed Lecture, which we co-sponsor every year with the Rothko Chapel. It will be live in Houston at the chapel this year, though it will also be live streamed. Caroline has put the information in the chat for the actual event, and you can tune in for more as we get nearer to the date. Now, as some of you know, our early post-Dobbs events and discussions that grew out of them led the center to plan the establishment of the Sissy Farenthold Reproductive Justice Defense Resource Project to ensure quality legal representation for those criminally charged in Texas for their pregnancy outcomes, with a focus on the impact of the criminalization of abortion on indigent and over-criminalized communities. And that's incredibly important to the discussion that we're going to have today, and it's why Aziza Ahmed is on our advisory board and why Wendy Bach is one of our partners in some tracking involved in the project. So reproductive justice is not only about the right not to have children, exercised through access to birth control and abortion, but it's also about the right to have children under the conditions one chooses and to parent them in a healthy and safe environment. Wendy Bach and Aziza Ahmed both work in multiple areas of law and at their intersections that are implicated by reproductive justice: family law, poverty law, criminal law, health law, and reproductive rights. And again, we're excited to have them here, not only because they're partners in our resource project, but because Wendy has written this incredible book and used some methods that we'll have the chance to borrow from, and because she and Aziza have long been in conversation on many of these issues with each other and with others. They both have extensive and impressive bios, and Caroline's going to put the links into the chat. And again, you can save and read more about them later. Before saying a word about Wendy's book, I'll just note that Aziza also has a book forthcoming with Cambridge University Press, and we hope to be able to welcome you back for a presentation of that book down the road. That's entitled Feminisms, Medicine, Law, Science, and Social Movements in the AIDS Response. Now, in Prosecuting Poverty, Criminalizing Care, Wendy Bach homes in on the effects of a fetal assault law that was passed in Tennessee on the lives of 120 women and their communities. She offers a compelling examination of the costs borne by the most vulnerable when criminal sanctions and surveillance become the favored legal solutions to social challenges. I'll let Wendy tell you about the book, but as will become clear, it is meticulously researched and has implications for reproductive justice, racial justice, and gender justice advocacy far beyond Tennessee. And it's received accolades from her peers. So alongside many glowing reviews, Professor Angela Harris calls the book accessible and riveting and a must read. Professor Kiara Bridges observes that Prosecuting Poverty, Criminalizing Care is required reading for a society that wants to imagine solutions to our troubles that do not involve carceral systems. So with that, I'll turn it over to Wendy to give her own version of her book.
So thank you for that unbelievably sweet introduction. I really appreciate it. It is a pleasure to be here and to talk to you about this long book project. I started this book project about 7 years ago. Thanks to Professor Engle, to Professor Ahmed, and to the folks at the Rapoport Center for making all of this happen. I want to begin talking about the book by locating myself in this work a little bit. So as I tell my students, I went to law school in the prior century, and I have represented folks for about 25 years in poverty courts. And I've represented folks both in public welfare settings, in cases around housing and public benefits, and also in more explicitly punitive systems in child welfare settings and in juvenile justice settings. So I have thought long and hard about the relationship between systems that support and systems that punish. In 2015, I was approached during a conference by a group of activists to ask if I could assist them in figuring out what happened to the women who were prosecuted for fetal assault in Tennessee. And that led to this 7-year project. I'm going to share my screen for a second and get this going. Hold on one second. Sorry. So as Professor Engle told you, on one level, this book is about a set of prosecutions. About 120 women, as she noted, were prosecuted between 2014 and 2016 for the crime of fetal assault, which was defined at the time as in utero transmission of narcotics to a fetus resulting in harm. These 120 women were part of over 2,000 documented prosecutions or forced interventions against individuals because of conduct during their pregnancies, documented by folks at Pregnancy Justice and a whole bunch of other people between 1973 and 2020. So just to talk for a moment about what happened, as you can see in this slide, in which red represents more prosecutions and orange, yellow, and then green represent fewer, the prosecutions in the state focused in a couple of different regions. First, in the northeastern Appalachian region of the Tennessee, most of the prosecutions took place there and focused their punitive efforts against poor rural white women. And then there were about 25 prosecutions down in Shelby County, the home of Memphis, Tennessee. those two, and Memphis, Tennessee is an urban space and a majority Black city. So we had very different kinds of legal systems operating, which turned out to be important to the story of what happened. So I like to show this image because it was at the time of the fetal assault law. This was an image one saw on the highway, in the hospital, really everywhere on billboards and bulletin boards, in courthouses. And what you see here, right, is a campaign by the Tennessee Department of Health, the Born Drug-Free Tennessee campaign. And this image really drives a lot of what was behind this law, right? Those who supported the law at the time said that the prosecutions would lead women to treatment, right? They said that through the discipline of the court system, these bad mothers, and quite clearly, right, if we look at the racialized image before us, these bad white mothers could be transformed, right? They would become perhaps good white mothers. If it worked, that was fantastic according to the proponents of the law. And if it didn't, they would get the punishment they deserved. So just to begin with this image, there's a very particular race story that goes on. But in 2016, this particular law sunset. So after that point, this particular crime and this particular conduct was no longer a crime in the state, which might lead you to ask why I spent another many, many years writing a book about it, and why I suggest that other people should read this book. And that the answer, as Professor Engle noted, is that the Tennessee fetal assault story is a devastatingly clear example of a far broader set of phenomenon in poverty courts and in poor communities. And that idea is the idea of criminalizing care. In short, as I argue in the book, for those we stigmatized, for those who are poor, often Black and brown, but also low income and rural and white, our systems say that the only kind of care they deserve is care mixed with punishment. So before delving into the data, I want to take a moment to talk about how I use the words in the title. While prosecuting poverty is fairly clear, our systems of prosecution target to an extraordinary degree those in poverty. Criminalizing care is a bit more complicated or opaque. Criminalization, at its most basic sort of law school sense, right, is what happens when society uses criminal law and criminal systems to address a social problem. So we use our criminal systems to prosecute crimes like murder, rape, robbery, assault, and individuals are punished within those systems. But criminalization has come to mean three additional things, as I argue in the book. So we sometimes make criminal conduct when a social welfare solution is available. The classic example here is, right, the laws that in effect criminalize homelessness by outlawing sleeping outside in urban areas and things like that. Criminalization also applies when social welfare assistance begins to feel like being processed for a crime. So we saw in the 90s and early 2000s, finger imaging, earlier home visits, right? This sort of surveillance and scrutiny that comes along with poverty support. But in the book, criminalization occurs when seeking help from a social welfare institution, when seeking help from a social welfare institution puts individuals at risk for exposure to other more punitive systems, including child welfare, or what I'll refer to from now on as family regulation systems or criminal systems. The word care I use capaciously. I use it in its broadest and most ethically imbued sense as what, at a minimum, we owe our members of our society in terms of safety, security, and health. So I want to focus first on that idea, which was both central to the fetal assault law and what I argue is a much broader idea. And for this, I want to take you to the legislative hearings that took place in Tennessee. So the first quote you're looking at is from a guy named Barry Stavis. He's the district attorney in Sullivan County. He was the guy who prosecuted the largest number of women for fetal assault. And he says, I think when we have this statute, and I've spoken to a couple of people, of agencies, and they're saying if the law passes, meaning the fetal assault law, we're going to be able to bring lots and lots of women into a program we're creating specifically for drug addicted mothers. And so I think with this statute, what we'll see is that there will be a vacuum for that, meaning treatment, and we'll see lots of programs and lots of judges, and we'll see lots of prosecutors wanting to do this and recommending this, and the judges, I think, will find the resources to do that. So his hypothesis here is that you have to create a crime to create care. The second piece of legislative history I want to bring you to is Senator Kelsey, right? Senator Kelsey told the participants in the hearing, and this was at the hearings about whether it would restart, so it had been in effect for a while. He says the other issue that this committee also needs to consider is that these women are usually not being sent to jail at all. But the beginning of the prosecution is what they'll be able to do to send them to drug treatment. That's another important and positive aspect of the bill. So again, right, criminalization is the road to care. And then perhaps most nefariously, Representative Finney says, we have a great drug court in Jackson, Tennessee, and I'm sure the drug court would benefit from something like this, meaning the crime, right? So here we see the logic being twisted even further, where the drug court is the thing to serve by the criminalization, because the drug court, which I think in his hypothesis is a valuable resource, becomes the reason to create crime. So to understand how bizarre this idea is of criminalizing care, of looking to punishment systems for care, I think you have to sort of disentangle your mind from that concept for a while, and to think about systems of support and systems of care separately. So, right, basically, right, our society has many, many institutions, all of which are structured through law. And the purpose of some of these legal systems, purportedly, is care, is support. So think Medicare, Medicaid, public assistance, food stamps, Social Security. That's what those systems are supposed to do. And then we have other systems that are designed to punish. The strange thing, though, and I think you saw it a bit in the legislative history, is that in poor communities, all too often, these two sets of systems, which we hope to be separate, are effectively merged. And my book explores through the case example of the fetal assault law cases and the systems in which they're embedded, what happens as a result. In short, what I set out to do on some level is to take the supporters at their word and attempt to figure out what happens, right? Did we in fact provide care? What happens when you merge care and punishment? And I look at this first through the data of the cases, and then later through a series of interviews with system actors in the communities in which these prosecutions happened. So the first question I asked, right, if as they're purporting this was really about care, we sort of, then this is what Professor Engle was referring to as some of the data methods. We collected all the court files we could get our hands on, and I'm happy to talk about methods at some, during the Q&A, but we gathered all of these court files and we coded them for a bunch of things. And one of the things we coded for was there any treatment, any indication at all in the criminal file that treatment was a part of the sentence? When we looked at the actual case files, what became clear was that the rhetoric of treatment served mostly as a smokescreen, hiding pure punishment. In the vast majority of cases, there was no indication in their criminal court files at all that the women were offered treatment as part of their case. And I think it's important to note that we were very generous in this coding. Any mention, right? 90 meetings in 90 days, referred for alcohol and drug assessment, all the way to inpatient care, we would code as some sort of treatment as part of the sentence. And it came out well under 30% that had any indication. So really, this was about, so despite the promise of those who supported the law, that it was about treatment, it was in fact about incarceration. And despite the promises, which you heard earlier, that jail played no role, women spent time in jail. both before pleading guilty for an average of 62 days in Northeast Tennessee, and they served extensive jail sentences of up to a year after pleading guilty. The case files also revealed things we already know that are systemic problems in misdemeanor prosecutions. Despite significant evidence that we uncovered that many of the women were in fact not guilty of the crime, the vast majority of women pled guilty. In all of the case files that we gathered, there were no motions filed, no hearings held, no trials held. So a few cases got dismissed for apparently various reasons, but the vast majority of time, there were just pleas, and there were pleas of guilty even in cases where it was quite clear that there were not sufficient allegations to support the prosecutions. And then because the prosecutions had focused and the rhetoric around the law had focused so much on neonatal abstinence syndrome, which is a short-term medical condition that infants can suffer when exposed to opiates in utero, we matched hospital records with the names in court records to see how many of the women actually gave birth to infants who had a NAS diagnosis, and about 30% had no NIS diagnosis. So there was quite a lot of evidence that a bunch of these women were not in fact guilty, but we saw here, as we see generally in misdemeanor prosecutions, really strong pressure to plead using bail and jail, and also using in these cases if women were incarcerated pre-trial till they pled, they were away from their children, and they almost always had an open child welfare case. So the additional pressure of the child welfare system piling on with the denial of bail or the very high bail, one as high as $25,000, pushed women to plead. So if it wasn't about treatment, what was it about? It was about money. As we know, the misdemeanor system is powered by and driven by fines, fees, and costs. And here we have a cost sheet typical of the misdemeanor prosecutions. And recall that I said, or I think I said, that all of these women were poor. We also coded for socioeconomics to the extent we could, and all of these women were low income. The vast majority had been determined to be indigent, and yet they were being assessed with enormous loads of criminal debt. So, but what about the cases where there was care? In a minority of cases, the criminal court files did indicate that the women were offered or were required to participate in some sort of treatment as part of prosecution. What's clear, though, from the research is that in poor communities, care is increasingly only available inside punishment systems, and that this particular form of care comes at high cost, high risk, and is often offered in a deeply corrupted form. So I want to talk about a little more structurally about the relationship between care systems and punishment systems. So on the ground and through policy and procedure and practice, I trace the ways in which law enabled presumptively confidential information to travel from when it was obtained in the healthcare setting into family regulation systems and ultimately into criminal systems, where it served as the basis for prosecution. Just to give you some sense of this data, the coding of the court files revealed that 80% contained information obtained or disclosed in a healthcare setting. This was medical information, presumptively confidential information in criminal court files, in pleadings, and these included diagnoses, test results, statements made by patients to healthcare providers. So that ended up looking like this. So this is a charging document from a fetal assault case, and you can see there's toxicology test results, right? You can there's prescription, right? And this is I have another one here, right? She didn't have a prescription for Suboxone. She tested positive for Suboxone. You can see the umbilical cord testing, right? There's a reference to the Finnegan score, which is a medical testing score for assessing neonatal abstinence syndrome. and diagnostic information. And this is the basis for the charge. So, and again, 80% of the cases contained information like this. So, one path by which like healthcare information and private information gets criminalized is in this path through the healthcare system into family regulation system often, and then into the criminal system. But it really isn't actually that simple, because there's another much more complicated and difficult to untangle path, which is care, the location of care proximate to or inside carceral systems. So in the sort of second half of the book, I use a lot of qualitative data. And we talked to professionals all across East Tennessee about these systems. And one story I want to tell is about a woman I called Cindy Jones in the book. It's a pseudonym, but she was a drug treatment counselor in a rural East Tennessee court. I asked her during our interview, what do you do? I had been told she's the lady to talk to in this particular jurisdiction. She's the one who can get folks into treatment. And when I asked her what she does, she said this: lock them up, clean them up, start them over, right? So care was accessible through punishment systems for her. The second person I wanted to talk to you about was a guy named Stephen Lloyd, who's the former director of substance abuse services in the state of Tennessee. I interviewed him about all of this and asked him about the relationship between punishment and care. And you can see on the screen before you, even knowing what I know, if I needed somebody in treatment that didn't have insurance, I'd tell them to go to Greene County and get caught shoplifting. They'd get into drug court and they could get them treated. And so this location of an access point of care inside punishment systems. And finally, plug somebody else's book, Dr. Carolyn Suffrin has written a book called Jail Care and runs a fantastic project around the real complexity of care inside jail systems. And jails have become primary providers for mental health and substance use treatment, and the deep complexity of that reality. So when I turn in the book from sort of the cases themselves to this concept of care, and I talk about care at a cost, and I talk about corrupting care. Care at a cost really came from those minority of cases where women did get access to treatment. The women, and I brought this map back up, which is the map of prosecutions, because it looked really different in Appalachia than it did in Memphis. Now, I want to couch what I say about all of this because we're talking about small numbers. But what was interesting in the sort of majority Black urban setting of Memphis versus the white rural East Tennessee prosecutions is that the only significant problem-solving court in these cases operated in Shelby County. So the women in Shelby County were all offered a spot, almost all, in the Shelby County drug court, and they got access to treatment. They also spent a lot more time in jail, had a lot higher fees, and because of the way problem-solving courts work, the risks they faced were much higher because they would be forced to plead guilty to and agree to a higher sentence on condition of accessing drug court. And then when they failed, as about 50% of participants in drug courts do, they ended up incarcerated at much higher rates. The women in Appalachia got less access to treatment, paid less costs, and didn't have the benefits or the burdens of problem-solving courts. So it becomes this very complicated situation. But in each circumstance, right, care, if offered at all, is offered at the risk and price of sanctions for failure to comply. So the second phenomenon that I talk about in the second half of the book is how care is corrupted. So Dr. Stephen Patrick, who is at Vanderbilt and is an expert in this field, said that the judges, right, who are making these decisions, particularly in the context of problem-solving court, are practicing medicine without a license, right? So inevitably, the person with the gavel and the person who has the capacity to send you to jail is making medical decisions in ways that are not appropriate or best in terms of care. I did not interview the women who were prosecuted for various reasons, but thank goodness other folks did. This is a quote from a study done by Sister Reach and Dr. Arisha Bowers, who interviewed women who are affected by the law. And this particular quotation is striking in terms of the idea of criminalization of care. She said the laws in effect prevented it from being a care issue. It became a law and a liability issue. And finally, I want to talk about the specifics of one particular care decision in terms of corrupting care. And that was the decision women face during pregnancy about whether to detox or whether to take maintenance medications during pregnancy. Now, the American College of Obstetricians and Gynecologists says very clearly that standard of care is to go on maintenance medications during pregnancy and perhaps afterwards, but that is the safest overall for the long-term health of both the mother and the child. The problem, though, is that, and I'm going to go back a couple slides. The problem is that if you stay on maintenance medications and test positive, a variety of rules, both federal and state, result in you being reported to the family regulation system because of some specificity in federal law and state practice. So the woman who chooses to detox contrary to best practices is less vulnerable to family regulation system intervention and ultimately criminal legal system regulation than the woman who fails to follow, right, who chooses not to follow that medical advice, who detoxes and then is not positive at birth. So it's just one example, a very particular example of how the merging of punishment and support corrupts care decisions. Sorry about that. So what do? Right? Fundamentally, we have to separate care systems from punishment systems by eliminating and narrowing legal pathways that allow communication between those systems. And we have to eliminate the on-the-ground reality that for many, punishment is the road to care. And finally, we need to significantly grow genuine care systems and shrink punishment systems. Before I get too deep into solutions, though, I want to acknowledge that this entire story is deeply intertwined with intersectional forms of structural bias. The idea, as I hope the book and this talk shed some light on, is deeply institutionalized in the rules, the practices, and the procedures of structures on the ground. That is why in some bizarre way, it made sense to create a crime, to create care. And as I think about solutions too, I want to think about some of the lessons of abolition. So the book does contain some reform suggestions, but what I try to keep in mind as I think about that is, does a reform fundamentally strengthen or weaken punishment systems? So how do we do some reforms that make things better without putting power and resources into punishment systems? What are reforms that shrink punishment and grow care? Or in the words of abolitionist practice, what does it mean to divest on the one hand and invest in the other? So attempting to propose solutions along those lines, one of the things I focus a lot about is blocking information flow. HIPAA, which I'm happy to talk about in the Q&A, is riddled with exceptions that allow for disclosure of information. So we need to close those loopholes and bar the use, at the very least, of healthcare records being used in pregnancy-related prosecutions. Maybe post-obs, there's some room to do that. And And then, in the child welfare space, I can talk some more about this, but I advocate for repealing mandatory report and getting rid of the provisions in federal law that require much of the reporting I talk about in the book. To address pathway number 2, right? This location is much more complicated and harder to get at with a sort of reformist perspective, but we do need to decouple care from punishment, divest from criminal and family regulation systems, and invest in care that is actually voluntary, that is actually private, and that actually allows women to attain the right to self-determination.
Great. I am trying to get myself back on. There we go. Thank you so much, Wendy. That was an incredibly thorough account of the book, and yet there's much more. Obviously, you wrote a whole book on it that you could talk about, and I look forward to getting into a little bit more deeply. And to do that, we'll have Professor Aziza Ahmed now provide some comments.
Yeah, thank you. Thank you so much, Karen, for bringing us together. And this was a really wonderful excuse to read a book that I already planned to read and have read in different versions before. I've been a longtime admirer of Wendy's work. So thank you for inviting me. And Wendy, thank you for writing this incredible book. I think, I'm just going to start with some praise because I think the book really deserves it. And then talk a little bit about how I see the book sort of situated in a set of different conversations, various conversations that are going on about some of the ideas that you raise. And then I thought I'd end with some questions. So like I was saying, thank you for writing this incredible book. It's really, I think, unique because it's one of the few books that's talking about criminalization and talking about pregnancy and doing it from a sort of legal perspective that's thinking about the rural South, that's thinking about Appalachia, that's thinking about communities that have really kind of been ignored in, not intentionally, but because of, just as there's been a need to do scholarship in this area, especially as more and more attention is focused on these communities, especially because of the opioid crisis. I thought there were so many contributions of this book. One of the big ones, and I was happy to hear that Dorothy Roberts is coming later to give a lecture in Austin. But one of them is one of the big ideas that I think really emanates from the book comes from and can be read through, the long critique by reproductive justice advocates, especially Dorothy Roberts, about the idea of choice, about the liberty, about the sort of neoliberal valence to the language of choice and liberty that's used in the reproductive rights context. And your book is this amazing and depressing and sad story about how various structural constraints shape choice, and also how, to take Robert's critique seriously, choice actually makes it harder for people, this idea of choice, because it lends credibility to this idea that actually your predicament is a series of bad decisions that you made about your body and your life. And, your book is really an account of how addiction is actually being treated as a choice. It's being treated as a choice because we're holding essentially people responsible for what's happening during their pregnancy, when in fact, I think we all know that as a public health matter, as a medical matter, addiction is not simply a choice. And, the carceral mechanisms that you described that essentially refuse to acknowledge any sort of structural harms. I thought another powerful thing that you demonstrate in the book, and this really resonates today with a lot of the critiques of the carceral state, with a lot of what we read in the literature on abolition, prison abolition in particular, is this idea that, Aya Gruber, Amy Cohen, and Kate Murgulescu called penal welfare, describing again the problem-solving courts, In that context, they were describing how sex workers and prostitution-related crimes are essentially being processed through anti-trafficking courts. It becomes a doorway that people have to pass through essentially in order to get care, in the exact same way that you describe, that in order to get care, you have to essentially pass through this criminal justice inflected process. In your case, it's very explicitly sort of the criminal justice system. And in their case, it's meant to be a sort of workaround, but very much inflected by a sort of similar problem-solving court. In that case, I thought it was interesting that sex workers, people who are being charged with prostitution-related crimes, really have to state that they're being trafficked. They sort of have to morph themselves from being a bad actor in the system to a perfect victim. I think, it resonates deeply with the way you describe how pregnant women are accessing, if at any at all, drug treatment through the carceral system. And it's a totally different context, yet so highly gendered. And I thought that overlap was really interesting and important. And maybe it's true of all problem-solving courts. I think the answer to that much better than I do. And it would be interesting to hear you talk about how you would situate these specific sort of problem-solving courts in the context of the broader range that are out there. I think your book really gets at and really speaks to the way the entire field of health law, and it sounded like the book Jail Care also is kind of addressing this gap, but the entire field of health law sort of ignores what's going on in the carceral context. There's sort of this weird exceptionalism of people in state custody when it comes to accessing healthcare. And your book is this incredibly nuanced story about how actually the delivery of healthcare and the way HIPAA actually works in people's lives is completely tied into the criminal justice system. And I thought it was a really in-your-face example of why there needs to be more of a focus on what's actually happening to people in custody or people under surveillance, essentially by the state in the context of criminal justice. And I imagine this also, could be broadened out to immigration and other forms of state custody. A part of the book that I thought was really fascinating that you didn't spend too much time on in your presentation, and I encourage everybody to read, is the breakdown of the bills that people received in the context of the care they were being given or in the context of their prosecution. And it was there that, I realized that a lot of, I think maybe, you've been doing this for so long. I wonder if you take some of the horrors of what's happening, as like part of the process, because what you see from this is that people are actually receiving bills for the time that they're spending in jail. So they're essentially paying for their jail time. And I thought that was a really powerful example of, and a really powerful chapter that got into the sort of mechanics of how not only are you sort of being prosecuted unfairly, not only are you not being given care, but now you're being billed for all the problems of the entire enterprise. And that was really powerful. I had a couple of questions. One is, I thought that quote you put up on the screen that's also in the person you're writing about is also in your book, lock them up, start them over, that sort of. I thought that was really interesting because there's an implication there that a person can actually be rehabilitated. And maybe I shouldn't read too much into one quote, but this idea of like, you lock them up, you take care of them, you start them over, you process them through the system, they're out the other side. And I wondered why people were allowed to make that, why people were making that assumption, is this a privilege born of something, of whiteness? I couldn't help but think of Jeff Ward's work on juveniles, who, in which he basically is saying that young African-American kids over time historically have been basically not allowed to have the same benefit of the doubt as young white children. We don't assume that you can rehabilitate a young Black child in the same way that you can rehabilitate a young white child. And it shaped our entire juvenile justice system. So I was just curious about that sort of idea of rehabilitation and what work it does. I was also really interested in, I was also really interested in You know, the way your book challenges some of the conversation that's been going on among progressives about the way the opioid crisis has essentially been treated as a public health crisis instead of a sort of a criminal justice crisis. And I think the pregnancy story, I'm so sorry, just give me 1 second. Okay, I'm so sorry. Okay, so, you know, like, do you think it's the gender dynamic? Do you think it's the, like, what is it that essentially is sort of making pregnancy a site in which you're hearing basically a completely different story about a public health crisis versus a criminal law crisis? The critique there, of course, being that when it's a drug crisis that's associated with African Americans, we treat it as a criminal justice, a criminal law issue, and when it's associated with white people, we treat it as a public health issue. I was curious to hear more about your thoughts on the idea of harm. You know, how and where does the state actually locate harm? It seems like they're locating the harm in the fetus, and it's so interesting to see how pregnant women are essentially displaced in the story of harm, you know, and who's actually being harmed by addiction, by opioids. I just wanted to hear more about that. And then finally, I wanted to hear a question that was kind of with me the whole time I was reading this book, but also since you've started this project, really, and since I've heard earlier iterations of it, you know, and that's one thing I've thought a lot about in the context of pregnancy prosecutions is the way the law and evidence, the scientific evidence that's put out there. So, for example, neonatal, the NAS, the neonatal syndrome. Basically, in the cases that I've looked at, there's a very clear, I feel like, and deep connection between the way the science gets legitimated and the law. So, and the prosecutions that are occurring. So, for example, I've written a little bit about this floating lungs test, which is used in a lot of stillbirth prosecutions. The test itself is really heavily criticized among forensic scientists, you know, among scientists. There's a lot of doubts that can be introduced about the test, and yet it gets used over and over in courts. There's sort of a legitimation function that the courts play in keeping this test alive. And, you know, and this is something also that's come out in Deborah Turkheimer's work on shaken baby syndrome, you know, basically that shaken baby syndrome kind of emerged through the prosecutions, that it became a thing because people needed to be able to prosecute women for shaken baby syndrome. And of course, and you write about, you know, the supposed crack baby epidemic in your book. But, you know, that too is a story of one physician who sort of mobilizes a set of ideas, does a very small study, and it gets picked up into the sort of trope of a bad Black mother and legitimated through the courts. And I was curious if you thought that neonatal abstinence syndrome was another example of this. This was really prompted for me because in a few of the cases that you discussed, the women were actually using cocaine and not opioids. And yet the discussion was still about neonatal abstinence syndrome. And what we know, and this kind of goes back to my earlier harm point, you know, what we know about neonatal abstinence syndrome in the cocaine context, or, you know, as I understand it, is that there's actually there hasn't been any proven long-term effects of cocaine use during pregnancy. So, you know, do we want to think about how neonatal abstinence syndrome is actually being made and legitimated even in the context of opioids, where we don't necessarily have some of the long-term studies yet? You know, what are the assumptions about truth that we're making and facts that we're making about neonatal abstinence syndrome? And this, again, is why I was asking about harm, because, you know, the way we understand that a woman ingesting or using cocaine during her pregnancy is innocent is because we have to understand that there was actually no harm. You know, that even if a fetus is showing some signs of withdrawal, there's no long-term consequence to that drug withdrawal that they're experiencing as neonates, or at least we can't identify it very cleanly with crack cocaine use. So that's something I would love to hear you reflect on a little bit as well. But thank you so much for this work, Wendy. I'm so sorry about the interruption, and I'm so glad to be in conversation with you.
No, let me do a little bit of this. I don't know if there are audience questions too. So I do think, right, like the race story of this book is so complicated, right? So I think there is, and maybe this answers two of your questions, right? But like it is absolutely true that these women in some way had access to at least an idea that they might be rehabilitated into a space of white motherhood that Black mothers don't have access to no matter what, right? Conceptually, at least. So this idea of lock them up, clean them up, start them over, right? And also, right, and the benefit of the doubt that I guess, right, like that woman conceptualized herself as helping, right? And right, so that was her rationale. And we are talking about, right, this hope around the opioid epidemic that you can rehab, but whiteness also, right, rurality and poverty and addiction all complicate access to an idealized notion of whiteness, right? So Matt Ray wrote a great book called Not Quite White, and in that book he talks about sort of keeping the conception of white privilege whiteness, right? You have to carve out folks from the whiteness, right? Like white folks out of that privilege, right? That idealized space to preserve the idea of whiteness as a privileged space. So I think in some ways these white mothers were living with the sort of tracks we laid down from the crack epidemic. But I also think if you think back to that original image I showed, right, like that idea of that perfect white baby, right, that there was more anger. There was also maybe you could access this notion of white motherhood, but you were going to pay to do it because you had degraded your conception of white motherhood. So I think race is just, it's a really interesting and complicated story that goes on. And I think the same is my answer for the white opioid epidemic. Like I think that this, right, pregnancy, right, once you become that vessel, right, and you compromise that white baby, your access to whiteness, right, is going to be compromised, right, for her. I think, in terms of NAS, right, NAS is a short-term medical condition. There is actually, there have been, because opiates have actually been around for a while, we have very little data to suggest there's long-term harm. But when I think about NAS, right, NAS isn't a particularly good proxy for anything from a healthcare perspective, right? Like it's a short-term condition, but if you say that's the harm and we're going to separate mom and baby because of it, and we're going to incarcerate mom, or we're going to civilly commit mom, right, and we're going to take that baby away, like what harm are you worried about at that point? So you're going to take this like innocent white baby, remove that baby from the family and the community and adopt or whatever you do, right? Versus thinking about real harm and real healing for that family unit, right? So it's, I think, it's an analog to the, and I also think we just love, and your reference to the junk science piece, right? Like we love like some expert who will get up there and be like, this is what's wrong. This is this bad thing, right? It's a very compelling court narrative. And it's an easy thing. Like you can point to the NAS cases and you can point to the numbers going up and you can think you're solving a social problem when in fact the social problem is much more complex than that. So I'm gonna, I don't know, Karen, if you have questions or if there are other questions. We only have a little bit of time left.
Great. We do have a few minutes, and I just said in the chat that if people would like to even post questions and comments, we'll make sure that we get them to you. I guess I'd like to hear you say a bit more about, because the last chapter of the book is a great playbook for all kinds of ways in which criminalization and reproduction are intertwined. And you have a section on the need to repeal mandatory reporting.
Yeah.
And I wonder if you could say a little bit more, and I know it's hard because the laws differ from state to state and on so many different issues, but that obviously has come up a lot in the abortion context now, as well as concerns about over reporting, over compliance. And I wonder if you might say something about the breadth that you would suggest in terms of repealing mandatory reporting.
So let me clarify just terminology wise. When I call for a repeal of mandatory report, I'm talking about reporting of potential abuse or neglect into the child welfare system. And in every state in the nation, mandated by federal law, states have a law that specifies who has to report in certain circumstances. The vast majority of child welfare cases, of family regulations, or cases of neglect having to do with poverty. And it is a system, right? You know, I think when we talk about criminalization of pregnancy, I was saying to Professor Engle last night, where like so many more of these women are in the family regulation than in the criminal system, which does not mean we shouldn't be talking about folks in the criminal system, but in terms of like scale of harm, family intervention is enormous. And we do not need a mandatory report law for somebody to report, right? Like we just don't, right? Like anyone can pick up the phone and report to an agency if they think a child is in danger. But what mandatory report does is make people worry about liability. And it also offloads responsibility for care out of care systems and into punishment systems. So I and many, many other scholars who write about family regulation systems are calling for the repeal of CAPTA and the repeal of mandatory report because we don't need it, right? Like anyone here, any can pick up the phone and make that phone call, but the incentives created by mandatory report lead to the bloat of that system that is, certainly in cases of severe abuse, we want some government system to respond. But that system on the margin and in cases of neglect does far, far more harm than good. See Dorothy Roberts' fantastic new book called Torn Apart.
Right. And thank you for, I mean, I do think that one of, there are many powerful points of this book, and Aziza, thank you for pointing out so many of them, because it is, as you say, at the intersection of so many different areas of law, including and thinking about even when you talk about abolition, it means abolition in a whole bunch of contexts beyond what we normally think about. Yeah. So it is 10 o'clock. We have one question, which is 10 o'clock here. What time is it there? It's 5 o'clock in Central Time, 6 o'clock for you two. And we have a question for the name of the book one more time, which is actually at the top of the page, Prosecuting Poverty, Criminalizing Care. And again, the link is there in the earlier chat, including for the discount code. And but it's worth every penny, even without the discount. So I'm happy that I paid for it before the discount was available. So thank you so much for your time, Wendy and Aziza. I look forward to continuing to work with you both. And again, I think the book is so powerful for its detail, as Aziza said, in the rural South and in Tennessee and Appalachia, but it resonates far beyond that and has many lessons for us. So thank you again.
Thank you. Thank you, Aziza.